Okay, here we're going to look at the iliopsoas muscle, which is a very strong hip flexor muscle. Okay, here is the muscle. So the abdominal muscles and everything have been removed, and you are now looking at the psoas part and then the iliacus part. And very commonly they are known as the iliopsoas muscle. Okay. The psoas, I'm going to isolate it. Very interesting. Look at this from the side view. So the muscle is deep in the spine and then dives forward and turns into part hip flexor right there. Okay. This is also a muscle that for active people is commonly tight and irritated, and because it does have a lumbar spine attachment, it can cause low back pain. So I'll get people that come in and they have this unique limp because of pain in the hip and low back, and then I start to assess the front side and they're like, why are you palpating in that area? And try to explain to them how this muscle behaves, especially given their sport, which often includes running. Of course, we find some hot spots and they light up and they're like, okay, well, so we take care of it, and that does help alleviate some low back pain and brings function back. Okay, the origin is the transverse process of T12 through L5. So you can see here the muscle does attach to the transverse process of T12 through L5. Okay, that's the origin. And then the insertion is down here on the lesser trochanter. Okay, the lesser trochanter on the femur. Its action, it will help with hip flexion. Why runners or people that do a lot of hip flexor exercises that they think are abdominal exercises, but really they're hip flexor exercise, the muscle can get irritated and very tight and start to cause some problems. Okay, the iliacus part goes from the iliac fossa, so the anterior aspect of the iliac fossa and the iliac crest. Okay, and it does go down to the inserts on the lesser trochanter as well. Okay, and that is also allows for flexion at the hip. Okay, we're on the lower extremity, the anterior aspect of the thigh. Okay, the muscle we're going to look at next is the sartorius, considered the longest muscle in the body. Okay, it does go from the hip down to the knee, so it crosses two joints, the hip joint and the knee. The origin is the ASIS, the anterior superior iliac spine, and the insertion is down on the medial aspect of the tibial tuberosity. Okay, its action, it will help with flexion at the hip, and then abduction, so abduction, and external rotation. So the action, to simply visualize it, is picture you're sitting down and you want to cross your leg. Okay, kind of the figure 4 style, right? So you bring your leg up, that knee goes out, you put your ankle on your opposite lower, distal thigh and knee area. Okay, crossing your legs. So that action is a pretty good representation of what the sartorius helps you do. It's also worth noting that clinically, this muscle can give a person some hip pain and knee pain. And the main reason is because most people have a pelvic unleveling, so the hips should be straight across, but in some people the hip is, one hip is higher than the other. Okay, so this hip is higher, that hip is lower, or it could go the other way, meaning okay, this hip is higher or that hip is lower. But because of that pelvic unleveling and the running and the CrossFit and all the stuff people do, it can cause hip flexor pain and knee pain. So when we evaluate people, we're looking for that stuff, as well as treatments on the sartorius as well. All right, next muscle on the thigh area is going to be the TFL, the tensor fascia lata. And we do have that muscle on both sides. Okay. Its origin is up here on the ASIS and anterior iliac crest, as you can see there. And its insertion, now the insertion is, depends on what anatomist and the book and all that you read, but so we'll address both aspects. Okay, the insertion is down here on the the lateral aspect of the tibial tuberosity. Okay, so there's the fibula. So this is the lateral side. This is the medial side, and its insertion is on the lateral aspect of the tibial tuberosity. Okay, this part is the TFL, and this part is the IT band. Okay, so some books will say that the insertion is on the IT band, so the TFL will go from ASIS down to IT band. And then some say it goes from ASIS all the way down to lateral tibial tube. Okay, so we address both. All right, now classically and clinically, the IT band is very tight on people. It can be very tight on people and cause knee problems and other biomechanical issues and pain. So a wonderful muscle to treat, responds very well to PT and other conservative management. Okay, the action is it will allow for abduction. Okay, so that means here's the midline. So it will help you go away from the midline. And some flexion at the hip and also internal rotation. Okay, so if you're going to activate the hip flexor stuff, it will help bring this area up. That's why runners tend to get a lot of IT band issues. These muscles will be the glute muscles. Okay, glute is kind of the slang. Gluteus is the official name, and we have 3 of them. Okay, the gluteus maximus, the gluteus medius, and the gluteus minimus. Okay. All right, these are very strong hip stabilizer muscles. In fact, almost 100% of the time, you can rest assured that the gluteus medius and minimus are likely inflamed and too tight and taut and tender with a person that's got some any kind of hip pain and or low back pain. All right, the gluteus minimus gets its name because it's the smaller of the 3 muscles. Okay, its origin is on the ilium, and its insertion is on the greater trochanter. Okay. Its action, it will help with abduction of the hip and a hip stabilizer. Okay. Next layer out will be the gluteus medius. All right. This muscle goes from the more superior part of the ilium down to the greater trochanter. So that's the insertion on the greater trochanter. Okay, so here's the origin, and there's the insertion, and it is a hip stabilizer and also allows for abduction at the hip. Okay. All right, then you have the gluteus maximus. Okay, the bigger of the three glute muscles, gluteus maximus. And its origin is on the sacrum, the coccyx. Okay. Iliac crest, and its insertion is down on the femur, the lateral, posterior lateral aspect of the femur. Okay, this area is known as the gluteal tuberosity. Okay, its action, it's going to help with extension at the hip. So that's why we do our squats and lunges and stuff like that, because as you're coming up, you're doing extension at the hip. Okay, we're going to remove the glute muscle. So look underneath, and this muscle here, the piriformis, this is a very important and clinically significant muscle because it can contribute to sciatica. So let's add the nerves here so you can see the sciatic nerve, and I want you to notice that the nerve runs underneath the piriformis muscle. Okay. What ends up happening in some people, this muscle, the piriformis muscle, will get really tight and it will shoot pain down the leg. Now, if you notice, the sciatic nerve does actually run down the length of the leg. So it basically goes from low back, okay, all the way down to your toes. So sometimes people will misdiagnose themselves and say, I have sciatica, which really they have a condition called piriformis syndrome. Okay. Now the difference is sciatica typically originates in the actual spine. Okay, we'll talk more about that when we get to the nervous system. But the bones in your spine can degenerate, your discs can herniate, there can be all sorts of spine issues, and because the sciatic nerve originates in the spine, as you can see here, we've got the nerve roots that come out, and eventually they come together to form the sciatic nerve. Okay, so a lumbar issue, and there's lots of issues people can have, a lumbar issue that pinches on the nerve causes sciatica. However, when the piriformis muscle flares up, okay, and gets tight, it will mimic sciatica. So sure, it feels like sciatica, but if you treat someone for sciatica and ignore the piriformis, you're not going to fix the problem. So there's some orthopedic tests to help you differentiate between true sciatica and piriformis syndrome. Okay, the origin of the piriformis muscle is on the anterior aspect of the sacrum. Okay, and the insertion is over here on the greater trochanter, as you can see there. Okay, it does help with external rotation, abduction, and extension at the hip. Okay, so based on those actions, runners, or any form of running, is susceptible to injuring the piriformis muscle.